How do hospitals manage status epilepticus emergencies? Imagine a situation where someone suddenly has a seizure that lasts too long or keeps coming back without stopping. This is called status epilepticus, and it needs quick, precise action to prevent serious brain damage or even death. Hospitals follow a carefully planned approach to handle these emergencies safely and effectively. First, the medical team rushes to assess and stabilize the patient. They focus on the airway, breathing, and circulation to make sure the person is getting enough oxygen and that their vital signs are stable. Checking blood sugar levels immediately is crucial because very low blood sugar can trigger seizures and needs to be corrected right away. They also establish intravenous access, inserting a needle into a vein to give medications quickly and to draw blood for tests. These tests help identify causes like electrolyte imbalances, infections, or toxic substances that might be contributing to the seizures. Next, they administer first-line medications called benzodiazepines. These drugs, such as lorazepam or midazolam, work fast to stop the seizure activity. They are usually given within 5 minutes of seizure onset to maximize effectiveness. If the seizure continues after the first dose, a second dose may be given promptly to increase the chance of stopping it. If seizures persist beyond 10 to 20 minutes despite benzodiazepines, the medical team moves to second-line anti-seizure medications. Drugs like fosfinidoin, levetiracetam, or valproate are given intravenously to quickly reach therapeutic levels in the blood. The choice depends on the patient's health history and hospital protocols. When seizures continue even after these treatments, the situation is called refractory status epilepticus. Patients are then moved to an intensive care unit where continuous EEG monitoring is used. This helps detect ongoing or subtle seizures that might not be obvious. To control these persistent seizures, sedative drugs such as midazolam infusion, propofol, or barbiturates are used to induce a coma and suppress brain activity. In some cases, specialized neurology consultation and transfer to a neurocritical care center are necessary, especially if the seizures are very difficult to control. Throughout this process, hospitals also investigate the underlying cause of the seizures. They look for infections, metabolic problems, or medication issues that might have triggered the event. Supportive care is vital too, including protecting the airway, managing fluids and electrolytes, and preventing complications. Once seizures are controlled, doctors often adjust or start long-term anti-seizure medications to prevent future episodes. After the seizure stops, patients are closely monitored for at least 24 hours with continued EEG to catch any recurrent or hidden seizures. Imaging tests and neurological exams help assess for brain injury or other underlying issues. Coordination with epilepsy specialists ensures proper follow-up care and medication management. In summary, managing status epilepticus in hospitals is a race against time. It involves rapid medication administration, continuous monitoring, and supportive care, all guided by established protocols and scientific guidelines. This coordinated effort aims to minimize brain damage and save lives, emphasizing the importance of professional medical treatment tailored to each individual's needs. Always remember, if you or someone else experiences a prolonged seizure, seek emergency medical help immediately and trust healthcare professionals to provide the best care.